Hi, everyone. Thanks for tuning in. It's been a bit. Dr. Lim and I were just talking, and we thought it would be great to check in with you, see how you're all doing, talk about everything that's going on with McDougall, answer any questions that you have. So great to see you all. Most of you, I'm sure, already know Dr. Anthony Lim, Medical Director of the McDougall Program. Great to see you, Dr. Lim. Thanks for being here.
Hi, Heather. Great to be here with everyone. Thanks for having me.
So I know you have lots of things to think about, and everyone always wants to know, what sort of questions does Dr. Lim get asked? What sort of things does he deal with on a day-to-day basis? So let's start out with that. You're seeing patients, you're meeting up with McDougall program graduates all the time and connecting with people during our 12-day program. So you really get the one-on-one with the McDougall program participants. So I would love to hear what kind of questions they're asking, what kind of things are coming up. So thanks for being here.
Yeah. What's interesting is I can literally just talk about some of the patients I saw today, without giving identifying information, which speaks to some of the most common topics. So, one was a woman who has been on one of these new weight loss drugs, right? And she's been on Zepbound um, for the last 6 months and has lost about 30 pounds. So that's certainly good and welcome. But at the same time, she had transitioned to a plant-based diet around the same time. So it's hard to distinguish how much is due to the weight loss drug, how much is due to the change in diet. But as many people are, she's concerned about the long-term potential side effects. And so we had a wonderful consultation about the long-term concerns with being on a drug like Zepbound. At some point, I think I will probably do a maybe an entire webinar on that, as well as ways to transition off. And basically, what I told her, the long and short, is that um, what the evidence shows when you get off these drugs, these weight loss drugs, the weight comes back on, the majority of it. Maybe not all of it, sometimes more, even more. But in some cases, maybe you don't put on all of it, but in the absence of fundamental behavioral change, the weight comes back on. So what I worry about is that when patients start these, whether it's Ozempic or Zepbound or whatever weight loss, one of these GLP-1 receptor agonist medications, whichever one it may be, what I worry about is that patients aren't thinking about the long term when they start this. Is this really a drug that they're going to want to stay on for the rest of their life? And if not, are they sure they want to get started on it? I think that it can be helpful if you're really dealing with a lot of medical issues and you just need a ray of hope and you need a life raft. So to get you out of a difficult situation. But please, even if you're taking that, really be thinking about how you're going to be changing the way that you eat, the way that you move, the way that you live your life in the long term. Hopefully, when so that one day in the future, hopefully, when you're able to get off the medication, you're able to keep that weight loss off rather than be one of the many statistics of people who just regain the weight right back, which can be, I mean, I can't tell you how many patients I've seen who have gotten off drugs like that only to have the weight regained and feel very demoralized by it. It is sort of a similar story to things like gastric bypass surgery, right? Where initially people can lose a huge amount of weight. And although I have seen certain examples of people who have managed to continue some of that weight loss, I would say the vast majority have regained much of the weight, if not all of it. So I sort of feel like we're seeing history repeat itself, but this time with a medication as opposed to a surgery. So we talked about the McDougall program, eating a starch-based diet, one based on fruits, vegetables, legumes, and whole grains, and getting healthy body movement, and really focusing on her habits and her behaviors as getting to the root cause of her weight and her medical issues. And I think she felt very hopeful after with a possible plan to slowly lower her Zepbound and eventually get off of it. So that was one patient I met for the first time. Another patient, many of you will relate, was someone who had been doing the keto diet for years. And she has diabetes, and she was, she was able to keep her A1C, which is a measure of your blood glucose levels for the last 2 to 3 months. She was able to keep her A1C to a relatively well-managed level of less than 7%, which is considered well managed. But she's not enjoying eating tons of animal products and doesn't feel great on that. And I could show you many studies of the long-term concerns about eating a very high animal-based diet in terms of heart disease, in terms of kidney stones, in terms of constipation. So I do warn people that who are on these very high protein, low carb diets that even if you're achieving some weight loss or some good management of your blood glucose, there are long-term consequences and implications that are important to be aware of. So we had a good conversation around that, and we talked about how to transition from that sort of high animal protein, high fat diet to a largely starch-based diet based on the McDougall diet, and some of the growing pains that you may experience. Because I'm not going to lie, it's not that it's super smooth right off the bat. That sometimes your blood glucose levels can actually increase because you've developed so much insulin resistance from years of eating a high-fat diet. And if you don't know how to interpret those numbers, it can be concerning. But basically what I told her is ride that out, because with each week that you're eating a low-fat, predominantly plant-based diet, your insulin sensitivity will be improving, your blood sugars will be improving, and you will join the ranks of many past and present McDougall patients who came to our program with diabetes on numerous medications and have been cured of their diabetes. So that gave her a lot of hope. And she is going to consider joining us for our May program as well. And then I saw another patient who is an alum of our program. So she's actually done our program twice in the past, and she's been doing overall very well. But she had a procedure that was looking at her carotid arteries, and it showed some blockage in her arteries, and she was referred to a vascular surgeon. And the vascular surgeon was basically strongly recommending surgery. And so she arranged a follow-up consultation with me to discuss the relative merits of it. And I was so glad she arranged that, because if you look at the evidence, and this is one of the things that we do in the McDougall program, we continue to stay in touch with our patients for life. And so whatever follow-up medical questions they have, we will research and look into it and give them our best advice. And I took a good look at the evidence, which essentially shows that for carotid artery blockages, that surgery, whether it's carotid endarterectomy or putting in a stent, does not show significantly better outcomes than medical management alone. And in addition, with numerous studies, there's been shown to be about anywhere from 2 to 3% perioperative death rate from the procedure itself. So you're taking on a significant risk by undergoing this surgery, presumably to prevent some future stroke. But that has not been shown to be superior to medical management alone. And I think that, I mean, ultimately it's her choice what she decides, but at least I was able to say, here at this program, I do the Yo Mama test, which is if it was my mama dealing with the same issue, I would not recommend that she undergo any procedure for this. I would recommend optimal medical management, which is typically antiplatelet therapy with something as simple as a baby aspirin and statins for high cholesterol, and I would call, and then of course addressing the root cause, which is one's lifestyle, and so continuing to focus on eating a very healthy McDougall diet and living a healthy lifestyle. So that's just a sampling of both new patients and consultations, as well as alumni who are following up with new medical issues that have arisen. And that's a very typical sampling of the kind of patients that I see.
I love that. I love hearing the stories, and that's one thing that I miss out on. And one of the things that makes graduation at the end of our 12-day program so much fun for me, because you share these stories and your interaction with the patients, and it's so touching and interesting. And I like that Yo Mama test. And that's what I'd want to know. Dr. Lim, would you, recommend this for your mom or your father or your wife? And,
Yeah.
I know that you're very honest in that way.
Yeah, I remember, I remember it was that I went to med school at Boston University, and it was my chief resident while I was on an internal medicine rotation who told me when I was taking care of a patient that, Anthony, when you're taking care of this patient, just keep in mind the Yo Mama test. And it really stuck with me. And so I think it's a good opportunity just to share a little bit about my approach when it comes to counseling patients. It's different. I think this is how it ought to be, but I'll say that it's different than what most patients experience within the medical system. So my approach to counseling patients is that there's one person and only one person that ultimately gets to decide what he or she does, and that's the patient. And so while I will incorporate the Yo Mama test and I will tell the patient, the best advice that I have, my support, care, love for my patient is not contingent upon the patient doing what I say. And that to me seems just a given that even if you disagree and you decide to choose your own path for your own reasons, I support you. That to me, that's a given, but that has not been my experience or my patient's experience within the medical system. They, I have countless stories of my patients interacting with specialists who basically, if they don't follow their recommendation of what to take, they get fired. Or if they don't get fired, they're made to feel very bad. And so they leave the office, crying or feeling disenchanted with the medical system or disenchanted with medical care, cynical, and it's really unfortunate. So I believe that part of the healing is actually the doctor-patient interaction. Even in the absence of any actual medication or lifestyle recommendation, I really believe in the relationship and the way that I am with the patient and our communication. I believe that is part of their healing, and I try to model that. So I will tell my patients, I think that you ought to take this medication, or I think you ought to lower this medication. Here are my concerns. Or if it comes to, this surgery for your carotid artery, here's the potential pros, here are the cons, here are the alternatives. And then it's up to them to decide. And that was exactly how I left off with this alumni patient. I said, if you were my mom, I would say don't do it. but but even if you decide to go ahead and do it, then I wish that it goes very well, and you have my support. And so, I would challenge all the people watching this now to seek after that. Have the kind of doctor that they're going to tell you what they would do if you were their family member, but at the same time, they respect your autonomy and they respect your ability to choose for yourself, because that is informed consent. Informed consent is you make the patient aware of the risks, the benefits, and the alternatives of of any procedure or any medication, and then they get to decide, right? And that includes, I even tell my patients, I'm going to tell you the best way I know how to eat. If you end up eating let's imagine the thing that's the most obvious. If you end up after our program deciding to eat an all carnivore diet, I'm still going to support you. You don't not, we don't kick you out of the program. We'll just say, how's that working for you? And hey, what have you considered this, right? We're going to keep partnering with you. So that's how far our care for patients goes. They don't even have to agree with us, but we are going to give them the best advice we know.
Thanks, Dr. Lim. We appreciate you. So I've got some questions in the chat. I know you have lots of things to talk about, but if you want to, let's
Yeah.
get to a few of these. So Dorothy wants to know, how does a person lower blood pressure without medication, which is remaining high even on a whole food SOS-free diet?
That's a great question. I'll answer it briefly, and then that may be a good opportunity to go to one of my slides that I had, because blood pressure came up. So, and you said that she is already eating a whole food plant-based.
Yes, so SOS-free diet.
Okay. So, given that most people are not eating SOS free, and just to explain, that's S for salt, O for oil, S for sugar. So, whole food plant-based SOS free means no salt, no oil, no sugar. That is not the McDougall program, right? We don't prevent patients from adding a small amount of sodium or salt to make their food tastier. But or a small amount of maple syrup or sugar to make their tea or whatever it may be tastier as well. That said, I will say for many patients with refractory high blood pressure, excess salt is a big culprit. So, one of the first things we will do is have them go do. I've had some patients do 2-3 weeks just as an experiment with no added salt. Now, I know that sounds wild, right? But some patients are so motivated to try to get their blood pressure lower that they're willing to do anything. And I say that doesn't mean you're going to be doing that for life. Really, what it's doing is revealing to you the effect and impact of sodium on your blood pressure. So we're doing, consider it a 2 to 3 week experiment, right? We're doing an experiment, and then when we get the results, we'll reassess if it's profound, the drop in your blood pressure. Then the question being, how much can I add in a little bit from the salt shaker while keeping my blood pressure at a relatively normal rate. Now, if in the case of this patient, if she's already eliminated all salt, oil, and sugar, my next question would be what the patient's weight and BMI is, because if she's whole food plant-based, no salt, no oil, no sugar, but she's overweight or obese, then there's something creeping into the diet, right? There's something that we need. There's something we're unaware of that we need to be aware of, because I would say by and large, the vast majority of people who are truly eating a very healthy plant-based, no salt, no oil, no sugar, which there's not that many, just so you know, are all at a very healthy weight. So if she's overweight or obese, I would want to know, because there may be something creeping in somehow that we need to know about. And I can't tell you how many times a patient comes on and says, I'm eating a very healthy, McDougall diet or very healthy plant-based diet, and they're overweight or obese, and 99 times out of 100, if not 100% of the time, we are always able through deep detective work to pick out the culprits, whether it could be something like nuts and seeds, excess nuts and seeds that are getting in, or dried fruit, or too many times eating out, or um, sauces. One of the patients I saw today, the one who was transitioning to a plant-based diet and seeing some of her blood sugars go really high, it turned out she was having, a decent amount of ketchup and sauces with maple syrup and things like that, and that can greatly elevate it. So that would be my next question. What is the patient's weight and what is their body mass index? Um, Assuming that your weight is at a normal, healthy BMI in the normal range of, let's just say, give or take 20 to 25, right? Um, I'm going to ask about sleep because there's plenty of studies that shows that poor sleep leads to elevated blood pressure, right? I'm going to ask about exercise, daily exercise, and how much that is a part of their life. And if they're not walking, jogging, moving on a daily basis for 30 minutes or more, I'm definitely going to have them incorporate that. And then the big one, the big bogeyman that people are often aware of is I'm going to ask about stress levels. There's plenty of good studies that show the effects of stress and anxiety on blood pressure. I mean, the most vivid example of that is what we call white coat hypertension, where patients when they check their blood pressure at home, their blood pressures are nice and normal, and then they go to see their doctor and it's 200 over 120. That itself tells you, right? I mean, all you've done is change the setting, right? One blood pressure was done at home, it's perfectly fine. You go to the doctor's office, it's sky high. Now, imagine a low level of chronic stress on your body. It may not be enough to raise it to 200 over 120, but certainly 140 over 90, yeah, easily, absolutely. And so I'll ask about stress, what sort of activities they're doing to calm down the limbic system. And that's going to be different. There's not one right activity, but I'll just throw out a few that myself or patients over the years have benefited from greatly. Okay, qigong, right? Sort of like a way of breathing. Tai chi, right, where it's nice slow movements based in ancient Chinese martial arts. Meditation, right? There's plenty of studies that show the benefits of meditation for not only bringing down stress levels, but also improving blood pressure. Prayer, right? Prayer and journaling. That's one of my favorites, right? Anytime I'm sort of feeling activated, I'm on my knees in prayer and writing and reflecting, and that tends to sort of calm me down. Talking to a good friend, going for a walk, one of the best. You get outside, you get out in nature, you're getting some exercise, and you're calming down. So all of those would be good ways. So we've talked about sleep, stress, movement, and sort of the hidden areas within diet. If you're doing, all of those are in check, you're moving every day, you would say your stress levels are low, and they truly are low. Not just you saying they're low, but people around you would say that you tend to be a pretty relaxed, chill, person, and you don't get uptight. You're not one of those type A control folks. And you're getting a good 7 to 8 hours of sleep and feeling well rested throughout the day, and your blood pressure levels are still elevated. There are some natural things like hibiscus tea, which has shown some good blood pressure lowering effect. And then the final thing I'll say is that in some cases it's acceptance. I mean, it's like Dr. Kim Williams, the former president of American College of Cardiology. He says, I don't mind dying. I just don't want it to be my fault. And I don't know. That's always stuck with me because all you can do is everything you can do, right? From a lifestyle perspective. And if I'm doing everything I can do in all the areas that I know matter, and then I still end up having this elevated blood pressure that's elevated enough that I need to take medication, well, then I guess I'm thankful that there's medication, right? Because we are not an anti-medication program. We prescribe medications, we keep patients on medications when necessary. We are just not a medication as the first resort program, right? If you imagine a pyramid of health, at the base of the pyramid is always going to be how you live your life and what choices you make around how you eat, how you move, how you sleep, how you handle stress, your work-life balance, your relationships, your spirituality, all of those, right? That's the foundation. If all of those are in check, then the next level of the pyramid is medications, and we can be thankful for that. Heather, I'm going to use that to transition to this slide. So let's see how this works. So I always like to incorporate recent topics that came up. And one of them was the use of chlorothalidone for hypertension. And any of you who have been following, who have followed Dr. McDougall over the years, you are well aware that Dr. McDougall's drug of choice for treating patients with hypertension has always been chlorothalidone. It is a great drug. It belongs to a class of drugs called diuretics. Dr. McDougall, over the many years, wrote monthly newsletters, and it's amazing reading this one from November of 2009 because so much of, essentially it all still holds true, right? Nothing changes. And he talks about chlorothalidone and why he likes it so much. In 1990, this MR-FIT trial showed a reduction in non-fatal cardiovascular events when hydrochlorothiazide, which is typically the first-line diuretic prescribed these days, even at Kaiser, one of the largest medical systems in the United States, hydrochlorothiazide is the first-line blood pressure medication prescribed. But it was changed with chlorothalidone in men at high risk for coronary heart disease with a reduction in non-fatal cardiovascular events. So it had superior clinical outcomes. It's more effective at lowering systolic blood pressure, which is often the number that patients have a tougher time with than hydrochlorothiazide. And typical starting dose is 12.5 to 25 milligrams daily, but the dosage can be increased to 50 to 100 milligrams daily. So I am in my 10th year now as a medical director of this program. It's hard to believe. It's been awesome journey, and I've loved every moment of it. And so over the years, I've seen countless patients who have been who have started on chlorothalidone and who have done great on it. But it is important to be aware of the side effects. And this was the thing I want to mention because it came up recently. I had a close family member who is dealing with refractory high blood pressure, meaning she was doing as much as she could from a lifestyle point of view to optimize her lifestyle. She was exercising regularly. She was eating as healthy a diet as she could. All right. I would not necessarily call it a strong plant-based diet, but it was overall relatively healthy weight. But she continued to have very high blood pressures. And so her primary care physician, at my suggestion, started her on chlorothalidone. And one of the side effects actually came to pass, which I wanted you to be aware of. The lesson that I want you to take away is all medications, even ones like chlorothalidone, which Dr. McDougall prescribed countless times, no matter how good they are, come with potential side effects you need to be aware of. And one of the major ones are electrolyte imbalances, specifically low sodium, which is also called hyponatremia, and low potassium, which is the scientific name is, or medical name is hypokalemia. It can also result in increases in your total cholesterol and your LDL cholesterol anywhere from 5 to 15%. Now, these are not a given, by the way. I mean, these probably happen in less than 10% of patients taking this medication, but even less than 10% is still a reasonable amount. And so I do want you to be aware of these. And then it can result in physical changes in terms of urinary frequency, right? Chlorothalidone belongs to a class of medication called diuretics, which causes you to urinate more. So you basically are losing fluid. And that is part of the blood pressure lowering effect because you just have less fluid that you're pumping around your body. So you pee more. And that's for that reason we have patients take chlorothalidone in the morning. Can cause headaches, dizziness. Sometimes the dizziness is because you have less fluid. Muscle cramping, irregular heart rate, gout, and in men, erectile dysfunction. And so what happened with this family member is that she experienced a very fast heart rate. And her heart rate was up into the 130s, 140s, which was very unusual for her. And immediately I asked her, did you get your labs checked? Because I had told her, make sure to get them checked within, anywhere from 2 to 4 weeks. And she had been on it for over a month and had not had her electrolytes checked. Sure enough, she got them checked. Her potassium was low. And so one of the problems with hypokalemia or low potassium is that it can cause irregular heart rates. And so that was what she was experiencing. So she didn't even need to take potassium. She ate a lot of bananas. She did switch blood pressure medication because in her case, she was one of the less than 10% that had an electrolyte imbalance. And she's doing very well on the other blood pressure medication she was prescribed. But it's just a caution, right? Like even Dr. McDougall's favorite medications, they all come with side effects, right? Nothing comes for free. So you want to check your electrolytes within 2 to 4 weeks of starting any diuretic agent, whether it's hydrochlorothiazide or chlorothalidone, and then check other labs like cholesterol levels or uric acid, which can, elevated levels of uric acid can cause gout, which is I've never had, but from what my patients tell me, it's very painful. Often comes in your big toe if you get an inflamed red joint suddenly in your big toe, or it could happen in your ankle or knee. It could be multiple causes, but gout needs to be on your radar. And so you want to check those annually. But overall, even if you're started on a medication, it does not mean it's a life sentence. You want to make every effort to get off the medication in the future if possible. And by that great question that was asked by the watcher earlier that Heather asked me, we already discussed the various lifestyle measures that you can incorporate to hopefully get off that medication. It happens to be that we excel. That's our specialty. The McDougall program excels in helping patients get off blood pressure medication. Average blood pressure reduction in patients with elevated heart rates of elevated blood pressures of greater than 140/90 is 14/11 millimeters of mercury during our program, with almost 90% of patients reducing or stopping blood pressure medication, right? So we're getting better blood pressure medication with better blood pressures with less blood pressure medication. That's what I call a win-win. And here are just 2 sample patients from a recent program. So sample patient 1 is a 70-plus-year-old female who had been taking lisinopril, which is not a diuretic. It belongs to a different class of blood pressure lowering agents called ACE inhibitors. She had been taking lisinopril 30 milligrams for blood pressure. She started eating the McDougall diet in 2024. Her blood pressure started going down. That is you need to be aware of this. One of the side effects of eating a healthy McDougall diet is that your blood pressure will go down. So if you're on blood pressure medication, you want to be cautious because being over medicated and having a blood pressure too low can cause real problems like lightheadedness. You could faint, you could fall. That's not great. So as a result, her medication was decreased, and her primary care physician finally just stopped it. He could not keep her on it safely. And during the January program, which she took part in just this year, her blood pressure were in the 110s to 120s, over 70s to 80s off all medication. So this is an actual patient that reversed her high blood pressure, right? So this is not theoretical. It's very real. It absolutely is what has kept me in the role that I've been in for these 10 years. I would I would have been out of here a long time ago if, despite all that we're doing, patients are getting sicker or they're being put on more medications. But it's because we see things that you don't see in the typical medical system, that I'm hooked, right? There's as Dr. McDougall and I would fondly say to each other, it never gets old, right? It really never gets old to see sick patients getting well by addressing the fundamental root causes of their sickness to begin with. Not to mention, she lost 4.5 pounds in 12 days. I should make a note for those of you who aren't familiar. We used to run in-person programs in Santa Rosa, which is where Heather and I are based. But ever since COVID, since August of 2020, we have transitioned now to completely online programs that are 12 days in length. And it's typically about 4 to 5 hours of programming a day, with a morning lecture, an afternoon lecture, covering topics ranging from, of course, healthy McDougall diet to healthy functional movement. We've got Jack Dixon, who talks about functional movement, to I do lectures on behavioral change and emotional eating. We've got Dr. Doug Lyle, who talks about a lot of the psychology. Heather and Chef AJ or others doing cooking demos. We've got Tiffany and Stacy, who are amazing support specialists that are essentially like your life coach, support partner, meeting with you not only every day during the program, but for up to 1 year afterwards. And then Jeff Novick, who is breaking down more studies than you could ever imagine on nutrition and the huge amount of evidence that supports this overall way of eating. So when I bring up these sample patients, these are patients who have gone through our 12-day program. Sample patient 2 was a 60-plus-year-old female who came in on 2 blood pressure medications, amlodipine 2.5 milligrams twice a day, which is a class of medication called calcium channel blocker, and losartan 25 milligrams twice a day. BID means twice a day, sort of this medical jargon. And losartan belongs to a class of medications called angiotensin receptor blockers. So she came in on a heavy dose of both of these. Knowing what I know about how blood pressure gets lower eating this way, I cut it back in half initially. Her blood pressure, despite that, were still in the 90s over 60s. That's how effective the lifestyle intervention was. And just for your reference, normal blood pressure is considered 120 over 80. So, anything above that is considered elevated. 140 over 90 is traditionally thought of as meeting criteria for hypertension. By the end of the program, I had to stop all her medication because her blood pressures continued to be so low. So she went from 2 blood pressure meds to none. And on top of that, she was literally scheduled to have part of her intestine removed in March due to a history of diverticulitis. And she was feeling so good from a digestive standpoint that she spoke with her surgeon and canceled the surgery. And we see this all the time, is that people who have all sorts of medical interventions and tests and MRIs and biopsies and diagnostic things scheduled, when they realize that so much of what they were experiencing, or their symptoms, or their malaise, or they're not feeling good, or they're feeling fatigued, or their aches or their pains, so much of it was based on what they were eating, how they were moving, how they were sleeping, how they were handling stress, how they were living their life. And that when we adjust these levers, they just start to feel better. They're able to avoid all these costly, unnecessary diagnostic measures and procedures and surgeries. So, we've never done the calculation of how much we save the US healthcare medical system, but I mean, it's got to be a huge amount. I mean, if you just imagine this consult I had with this alumnus from earlier today, it's gonna be, I gotta think like thousands and thousands of dollars for this carotid. I mean, anything that involves cutting into your neck in our medical system is gonna be thousands and thousands of dollars. I don't even know what the cost. And if she ends up, just focusing on the lifestyle because of the lack of evidence to support it, look at how much that's going to save. Not to mention um, the potential side effects of as serious as death on the operating table that she could face if she did it. Right. Now, I do want to clarify. There are times when surgeries are indicated. Right. So it's very patient dependent. When we have certain patients that just come in and they're dead set against avoiding all medications, all surgeries. And sometimes I have to talk them off that ledge that, hey, in your case, I think this diagnostic procedure, I think this surgery is indicated. I think it could be life-saving. And we have that conversation. So I think that the art of medicine really shines through because we treat each patient in their individual context and adjust accordingly.
Well, I think part of that, Dr. Lim, is that you get to spend so much time with each patient, and really get to know them and what their needs are and what they're willing to do, how much they're willing to change, and you work with that. So I think that's
Totally.
one of your gifts.
Yes, I appreciate the extensive time I get with my patients. And I like to think that I'm a doctor that meets my patients where they are at. Um, I just told one of the patients I was talking to today um, that a lot of times people will say, I just can't do it, or I can't do that. And my question is, what's it or what's that? I tell patients there's not a food I'm going to say you can never eat again. That's too personal for me to say. Um, all I'm asking you to do is eat more fiber. Can you do that? Can you eat, more fruits or more beans or more brown rice, potatoes, sweet potato. Let's see, today, what did I eat a lot of? I ate a lot of pumpkin. We got a lot of pumpkin in our CSA, our community supported agriculture box. So I've been roasting and eating lots of pumpkin. So that was good. And homemade sourdough bread by my wife, which I've been very spoiled by.
Well, I think that's a good approach, is telling people what they need to be eating more of rather than taking things away. So eat more fiber, eat more starch.
Yeah, because folks, we're in this for the long haul. All right. We are not, we have, I wouldn't say zero, but very little interest in a short-term result that is not sustainable. And that's why I have not been taken by the weight loss drugs. I'm just going to say, I mean, I'm not going to say they're all bad. Don't get me wrong, but I'm not like, oh, they're amazing either because of the lack of long-term data. Now, what to me would make, say, a drug amazing is that you take it, you get some significant outcome that's beneficial with minimal side effects, and then even after, let's say you stop the drug, you sustain the benefits. I would be prescribing that like crazy as long as that was true. But show me the data. It's not there. And I just think that human behavior is it's a tough thing. And there really is no magic pill. I mean, I guess this is what maybe comes the closest to it. And yet I'm not, I'm not thoroughly impressed. So we are not into short-term results that go away as soon as you're out of our auspices. And that it's for that reason that, as Heather and I alluded to, we're much more in favor of encouragement. Like, what do we want you to eat more of? Because I found that, forbidden fruit doesn't tend to go well. When you say you cannot do something, the human will just finds a way to, maybe you can withstand for so long before you just kind of burst and then you go crazy and then you use that as an excuse to say that was impossible, I'm not going to do that. So yes, do we tell patients to try to cut back and minimize, if not eliminate oil? Yeah, sure. But does it mean that if there was some oil in your food that you can't do this program? No, absolutely not. Do we tell you to try to cut back animal products or eliminate them? Sure. But if you have a special occasion and you want it, are we the police that says, oh no, no, it's not our role, and that's not what's needed or necessary in the vast majority of cases for patients to succeed and do well.
Yeah, my dad always said that you get out of it what you put into it. And the other thing he says is, I don't have to teach people how to cheat. I teach them the optimum diet and they do with it what they want. So
Yes, it's an
you have
invitation.
that, right? Yeah. This is what you can do, but what are you willing to do? Thanks, Dr. Lim. Let's see. We are running out of time and lots of questions coming in. So you and I are going to have to do this more often. Let's see. Question from S. Foss. They've been following the program for over a year faithfully, over 90%, but their cholesterol is still about 220. Should they worry about that?
Oh, what a good question. Yeah, so it depends, right? So again, the more that I can get patients thinking multifactorially, the better. I almost never zero in on one number and then make some large conclusion based on that. So why do we care about cholesterol? Well, we care about it because we care about your heart, right? And we care about your blood vessels, and we care about trying to avoid a heart attack, stroke, or death, right? So is cholesterol the only thing that matters when we're talking about your cardiac risk? No, there's so many others. What do you weigh? Because we know, again, getting back to weight and BMI, right? I'm not weight focused just for the sake of a number. I care about weight because studies actually show that being at a healthy weight improves your overall health and likelihood of cardiac issues or cancer or all sorts of stuff. What's your blood pressure? What's your blood sugar level? Why do we care? Because diabetes is a risk factor. Hypertension is a risk factor. How physically active are you? Are you moving every day? Tell me about your stress levels, because even if all your numbers are great, if you're at a high stress, we know that that's causing damage to your blood vessels in ways that you may not be aware of. Tell me how you're sleeping. All of these things matter. So we're going to put together a whole picture based on that. Another good test to further stratify your risk is what's called a cardiac CT scan. And I'm not necessarily a fan of tests just for the sake of testing, but I like this one in certain patients because what it will do is show your coronary risk and the calcium deposits in your coronary vessels, and give a likelihood, a 10-year likelihood of you having some cardiac issue. So why can this be helpful? Let's say you're eating a healthy 90+%, you're at a healthy weight, all those other risk factors I mentioned are good, and all you got is this isolated high cholesterol. Well, if your coronary heart scan is low, meaning the ideal score is a 0. I've never had this test, but the best score is a 0, which essentially means you're not at risk. And then good is anywhere less than 100. That's good. And then once you start to get over 100, you start to worry a bit more. But if you get a coronary scan, and let's just say it's 0, then believe it or not, my advice would probably be, why don't you stop checking your cholesterol? Because it's unlikely going to change. You may just fall into that small percentage of patients who has high cholesterol, but every other risk factor is good and your vessels are clear. right? So the likelihood I've had plenty of patients over my decade now. I love being able to say that, my decade of service at this program, who have had these high cholesterol levels with a clear coronary heart scan or no other risk factors at a healthy BMI of, let's just say, 22 to 23, and they're not the ones experiencing some early cardiac issue, right? So you always want to think about what it is about the number. Why do we care? And how do I get a fuller view into my overall risk to better make a decision about how to proceed? Um, if that coronary heart scan does show some concern, then either it's an impetus for you to go from 90%, sorry, but now you may have your motivation, right? You may have your why. Before you didn't have your why, so you can be thankful. Now you've got your why to go from 90% to 100%. I mean, I'll be honest, I'm not 100%. But if I had certain tests that made it clear, because the reason, if I'm every health measure that I'm after, I have. If the universe came back to me and gave me certain health indications that I need to step up my game, then maybe I go from 90 to 100, right? And so that might be one change that would make, or it'd be a conversation, but maybe it would suggest that you might want to take a baby aspirin, or maybe you might want to take a low dose statin medication, right? I would say there's no absolutes, but there's levers that make it more likely that you ought to do this, or that the benefits of being on a medication such as a statin or aspirin start to increase. And this is the benefit of having a good doctor relationship where you can have a healthy conversation around it. But great question.
Thanks, Dr. Lim. Would you like one more? Or I know you have some other things that you'd like
Well,
to
I
talk
had
about.
one. I mean, I could save.
Go for it. Let's talk about it.
Okay, all right. Let's talk about it. So it's one of my favorite topics. Heather's heard this a lot, but I get asked it
It's
so much,
important and it says so much about the health of someone. It's a great indicator.
right? Okay, so let's go.
Everyone's wondering what we're going to talk about.
Oh, wait. Oh, well, this is just, I want to show some pretty pictures. This is, we are a fan of simplicity. So just so you know, one of the things that I pride about the McDougall program, not only the results we get, but the simplicity of it. I love cooking ever since the McDougall program because I just make huge batches of things like this, you know, water stir fried tofu with veggies, and this was some black rice. And I basically make big pots of food at the beginning of the week. I just finished my last bowl yesterday of a combo I've never made before because it's what I had. It was purple cabbage and pinto beans. And I threw it all into the pot, and the instant pot, with some broth, and let it go. And that supplied me for all of last week. So we're all about simplicity. You can make it fancy and complicated, but it doesn't have to be. And then movement. We're recommending you get out in nature, walk 10, if you've been sedentary, walking 10 to 15 minutes a day. Nothing complicated. Just get out there, get going. I talk a lot about changing your identity, right? So if someone has this identity that I'm sedentary, right? That is how they conceive of themselves. I am just someone who's sedentary. I'm like, okay, I accept that, but I'm here to try to change that. So what I want you to do is start to conceive of yourself as someone who moves every day. But I don't want you to just say that but not do it, because then that's hypocrisy, right? So I want you to actually start acting in a way that's creating your new identity, right? And James Clear, in his book Atomic Habits, talks a lot about this. It's one of the best books on habit formation I've seen. So I really like this idea of changing your identity. And so I encourage patients, hey, to start with, don't get fancy with your movement. Just start walking. We're bipedal, right? We were meant to walk. So use it or lose it. Start walking 10 minutes a day. And then let's see from there, with a foundation of daily movement, you are now someone who can honestly say, I'm someone who moves every day. It may not be a lot, but it's something, and you can build on something. right? You can build on that. Then you go from 10 to 15, 15 to 20. From once you've got a good walking habit in, then I'm going to start to press you into more like resistance training, or whether it's just light plyometrics, push-ups or squats, but something to really build muscle tone, and getting out in nature anytime you could. I put this right after the talk on blood pressure, because these are some of the things that we're going to be talking about for things like blood pressure or diabetes. And I want you to notice one thing. Again, this is so simplicity, effectiveness, two of the things that keep me coming back year after year to this program. The third one is integrity, right? All our recommendations, if you notice, we don't get a commission off of. I mean, if you spend more time in the forest, guess what? Heather and I, we get Zippo. If if after this talk you're inspired to do some batch cooking and you go to the produce section of your grocery store and buy some brown rice and some broccoli and tofu, guess what? We get Zippo. So I'm actually proud of that. It may not mean that we're the fastest, most profitable, but I guarantee you, Heather, Jeff, Tiffany, Stacy and I, we all sleep well at night. And it really is one of the virtues and character traits that really stands out with Dr. McDougall, his integrity. And I'm very proud of the fact that we carry that tradition on. We are not what I would call a very commercial program where we're selling all sorts of products to try and hook you in to some lifelong subscription, right? I mean, ideally, we impart our thing, you run with it, and although I'd love to see you, if we don't see you again and you're doing great, then really we succeeded and we did well. So the question is, how do I address my occasional constipation? I get asked this all the time, as recently as yesterday morning. All right. I had a friend say that she had been constipated for 5 days, and this had never happened to her. And I mean, we kind of we kind of laugh, but it's actually quite serious, right? She was very scared. She was worried that something like serious was going to go on, and she was incredibly uncomfortable. And so, the best way, I mean, at that point, whatever it takes, whether it's Miralax, or using an enema, in severe cases, I've had to do this before, you need to go into the emergency room and sometimes be manually disimpacted. But the key is you've got to get flow going again, right? You've got to get exodus and clear the pipes. But what I want to talk about is preventing it from happening in the first place. I take bowel movements very seriously. I'm not uncomfortable to talk about it. It comes up a lot at dinner time conversations when I'm there. So, and it's because I think it's so important and we don't talk enough about it. Just briefly, this is a stool chart that shows it's like the Goldilocks principle. You don't want it too hard. You don't want it too soft. You want it just right, right? So a nice bowel movement is one that's, semi-solid and passes easily. You're not straining to have to go. Generally, I think that an optimal frequency is once a day at minimum. Okay, once a day at minimum. More than you care to know, but I'm often 2 to 3. So if you are 2 to 3, hey, join the club. Welcome. That's what happens when you eat a super high fiber diet. I mean, not to brag or anything, but I would venture to guess I'm in the top 1 percentile of fiber intake in the world. And so, one thing that happens when you eat over 50, 60 grams of fiber a day is that you may have to go more. That's perfectly fine. I can be assured that I've got clean pipes. So, but at a minimum, once a day, I think is a good frequency. And what I wanted to just kind of get in your head is, look at that, 4 F's of healthy bowel movements. And I'll go through these rather quickly. The first one is fiber, a high fiber diet. And that is really the fundamental what the McDougall program is based on. If I had to leave you with 3 words, okay, 3 words for how to eat for the rest of your life, and I only get 3 words, it would be eat more fiber, right? Eat more fiber. Because guess how many grams of fiber are in animal products? 0. And guess where you do find fiber? Fruits, vegetables, legumes, grains, all the plant foods. So just by getting you to eat more fiber, you're going to, by extension, be eating more fruits, vegetables, legumes, grains. We know from countless studies the benefits that that does for your overall health and for your stools, because that's what gives it the volume. If you have lots of mass but not fluid, then it can get stuck, right? So another one of the benefits of a plant-based way of eating is that it tends to be high in water content. So oftentimes you don't even have to focus too much on getting adequate water. You just eat things like watermelon and peaches. And right before this, I just had oh my gosh, those sumo mandarins are amazing. They're just so easy to peel. I just had a sumo mandarin. It's so good. That's just chock full of fluid. So if your urine is light or light clear or yellow, light yellow, then you're probably fine. I never have some set amount that I drink a day. I just make sure that my pee is light colored, and then I'm pretty much know I'm getting adequate fluid intake. Your bowels like to be jostled around. That's what kind of gets the peristaltic movements going. So the other F is the fitness and the fun. And are you noticing a theme? Patients who know me know I talk about movement all the time. I am someone who moves every day. Anyone who knows me, any friend, any family member, I am just known for climbing trees, jumping in lakes, hopping over fences, sitting on the floor. Right now, I was just telling Heather, I'm very excited because I'm at my stand-up desk, and I just converted from a sit down to a stand-up. So now I'm like, doing this talk and bouncing around and standing up. So it's a much more active pose. So I'm very excited about that. And it's going to help your bowel movements. Look at that. Look at how all these fun puzzle pieces connect. And then last, and this is my favorite because it's the one that people often are unaware of. And as anyone who knows me, I like helping people to become aware of what they were unaware of, right? Because that's exciting. That's like a light bulb moment. So the fourth F, everyone think in their heads what the fourth F could be. What's missing from this picture? Right? Active learning means trying to guess it yourself because it just lands more when you try to figure it out. All right. It's frequency of sitting. So the way that most people do it is they wait till they have the urge before they go. And that can work the majority of the time. But what about when you don't get the urge? Then that means that you're possibly just letting your stool sit inside your gut. And oftentimes you see this happen during stressful periods or during periods of travel, okay? Because you're switching time zones. So what people don't realize is that the gut has an entire nervous system called your enteric, E-N-T-E-R-I-C, enteric nervous system. And it can be trained. You can actually train your gut, I mean, like a pet. And so what I recommend is that irrespective of whether you have the urge to go, please sit and give your body the chance. 9 times out of 10, you're going to have a bowel movement. It may not be a lot. It may not be what you're accustomed to, but the point is you're essentially telling your gut, you're like, hey, we just had breakfast. It's morning time. I had my black coffee. All right. So now is your usual time. I know you're not feeling it, but we're going to sit anyway. All right. And, kind of a funny story. I did this with my kids. Josh was now 17, Julia's 13. They know from the time they were young, Daddy, I don't need to go. What are they going to hear? I want you to sit for 5 minutes anyway. Guess what, Daddy? I had something. I had a poop. They get so excited. I'm like, oh, isn't that interesting? Wow. right? That's just how it works. It's so cool to see. So I never get tired of it because I traveled to France recently and major time change. I just sat at my usual time every day. And sure enough, I was very, very, I didn't go a single day without having my bowel, one or more bowel movements. More than you ever cared to know about Dr. Lim's bowel system, but hey, that's the kind of doctor I am. Like, right? Sometimes there is a TMI, too much information. So fiber, fluids, fitness and fun, and frequency. So at least once a day. Sit on the toilet. Don't strain, right? If you ever took a selfie and you're like this, that's straining. All right, you're gonna give yourself a hemorrhoid. That's how hemorrhoids happen, is from sitting long periods of time. You don't want that. Right? Just relax. Just allow it to happen. And if it doesn't happen, it's okay. Just because once a day is a good frequency, the worst thing you can do is get all uptight and really sort of anxious because you didn't have it. Just, stay on top of it. Maybe go get some Miralax, just make sure that you're saying, hey, gut, I'm aware we're on top of this. Because the longer you go, this is the important thing. The longer you go, each day that you go without a bowel movement, more of the fluid from your stools is being reabsorbed. So you're essentially getting drier, harder stools that are impacting. So you do want to stay on top of it, but don't, don't freak out. So that was my little
Thanks, Dr. Lim. Probably more than we ever wanted to know about poop, but we all do it. So I appreciate you talking about it.
my pleasure.
We went a little bit over, but it was really great catching up with you. And I've got lots of questions that we didn't get to, but that just means that we have to do this again. So
Absolutely.
lots of people
Yeah,
are
if you send
commenting
them,
in the chat.
you can send them to me too. And then, yeah, when we do it again, I'll have more fun slides lined up for all of you.
That'd be great.
All
Thanks
right.
everyone for tuning in. Thank you so much, Dr. Lim. It was great meeting with you.
Great to see you, Heather. Great to see everyone. All the best. Take care.
Thanks everyone. Take care. See you next time.